Coming of Age is coming up next. I'm your host, Josh Newby. First today, we're learning about COVID-19's effects on heart health. Then we're gearing up together for hurricane season and making sure our elderly neighbors stay safe. Finally, a vital multi-generational community program that is at risk locally. Stay with us. Coming of Age starts right now. As we age, staying active in life and involved in the community can become a challenge. But with Council on Aging of West Florida's range of home-based services, you remain healthy, independent, and engaged. From Meals on Wheels and respite care to senior dining sites and the retreat, you'll feel empowered to regain your freedom while retaining what makes you, you. We've been in the community for nearly 50 years, advocating for elders and supporting those who care for our parents and grandparents. We were there when your father's health began declining, when your mother needed companionship during the day. And guess what? We'll be there down the road when you need those services too. Now, join with us as we talk together about the aging issues that matter to you. A growing number of studies suggest that COVID-19 could have lasting negative effects on our cardiovascular and heart health. Baptist Heart and Vascular Institute joins us now to tell us more. Doctor, thank you so much for coming on today.
Thank you.
Tell us a little bit about yourself and what first led you into the field of cardiology.
Okay, well, thank you. I am originally from Ohio, and I was born and raised there. I went to medical school there, and I have a very strong family history of heart disease. My grandpa and his 11 brothers and sisters all had heart disease. So I was very intrigued at an early age of learning more, and then knowing that I wanted to be a doctor, wanting to help others and help others with heart problems.
What have you learned about the link between heart disease and COVID-19 over the past year?
It's been very difficult. It's been a very difficult year for everyone. And as a cardiologist and as a interventional cardiologist, I have seen patients who typically would present to the hospital with chest discomfort or concerns for heart attacks, staying at home. That would have been more in the earlier to mid portion of 2020. And then if they did come to the hospital, they would present late, mostly for fear of being exposed to COVID in the hospital. So from my end as an interventionalist, we felt the need to encourage patients that if you were experiencing chest discomfort or shortness of breath or symptoms that may be related to a heart attack, that yes, it is safe to come into the hospital and be evaluated and treated. So that was something that's been very difficult to deal with, and then also to try to encourage patients when you're, enforcing social distancing and trying to stay safe to still come into the hospital. And then the other thing from COVID, I've had a personal experience getting COVID-19 myself and being very careful, social distancing, masking, and being able to see from the other side what people would experience. So the coronavirus has been a very, very difficult year. And then I've had patients, thankfully for myself, I just had mild symptoms and recovered quickly. But for my patients, I think that they often refer to them as long haulers. And so that has been a progression on if the symptoms still linger months after your COVID infection, that you are still okay and you will get better.
How does COVID-19 affect heart disease?
Good question. So we're learning, continuing to learn more about COVID. And so what we know cardiovascular wise is that COVID affects the heart both directly and indirectly. So COVID can directly affect one's heart muscle. In that case, we would call it a myocarditis, which is an infection, inflammation by many viruses to the heart muscle. And then COVID can also direct the heart, can affect the heart indirectly through inflammation. And so we see this with the blood vessels being inflamed. Patients then do not have the reserve that they previously had. And so this may present with congestive heart failure. It may present with heart attack. It may present with electrical abnormalities such as an irregular heartbeat.
If you have heart disease, are you at greater risk of complications from COVID-19, and what does that look like?
Absolutely. So one of the scary things, going back to your previous question about what I've learned from coronavirus over the past year, is that while high blood pressure and obesity are risk factors for heart disease, they also put you at a higher risk to have a more serious course if you were to get the coronavirus infection. So it's concerning. And if you already have underlying heart disease, if you have congestive heart failure, you've had a stroke, you've had a heart attack in the past, then you as well are at higher risk to have a more severe case of COVID.
How many people who are hospitalized with COVID have had cardiovascular complications in the past?
That's a great question. So I think that some of the estimates, and we'll learn more as time goes on, but they estimate that perhaps 20-25% or higher of all patients who get the coronavirus infection will have some degree of cardiac complication or cardiac involvement, even if you're asymptomatic. But when you go to the hospitalized patient, so now you're looking at a sicker group of people who are requiring hospitalization, they actually estimate that perhaps 40 to 50% of those patients will have some degree of cardiac involvement. And the issue is, it's not even about getting through the course of the hospitalization. It's what are the effects, both shorter term and long term, going to be on those patients as well.
Will screenings detect cardiovascular damage from COVID-19, and do you expect those screenings to become a routine part of post-COVID care?
I think so, because at least from my experience in practice, I have patients that have COVID and post-recovery still have symptoms or a worsening of their subjective symptoms. And so I think that as people want to exercise and get back to some semblance of normal, we will continue to screen to make sure that there's not been a cardiac effect. But especially if you have symptoms, shortness of breath or fatigue or palpitations, fainting, passing out, chest discomfort, you should talk to your doctor, or if you have a cardiologist, speak with your physician so that you may be appropriately screened with those symptoms. I think the other question will be, what happens if you are essentially asymptomatic and have COVID, then what? And that's what we're still trying to answer.
And last question for you, how do people make an appointment? Do they need a referral from their primary? How does that work?
Well, thank you for asking. So I am accepting new patients. I am happy to evaluate anyone, and they do not need to have a referral from their primary doctor, although that is acceptable as well. So if you feel that you need a cardiovascular evaluation, please feel free to contact 850-484-6500, and I will be happy to see you in consultation.
Great information, Doctor. Thank you so much for joining us today. Next, hurricane season is upon us, ready or not.
Why do people love ACT's retirement life communities? There are more reasons than just the active lifestyle. Like ACT's Life Care, a plan that protects your nest egg with predictable monthly fees, even if your healthcare needs increase, so you can enjoy a carefree today and a worry-free tomorrow. Plan a visit and see why our satisfaction rating with current residents stands at 98%. ACT's Retirement Life Communities, where loving kindness lives.
The Beacon at Gulf Breeze offers the finest senior living community in the area. We are here for your loved ones who need assisted living and advanced memory care services. Seniors will feel right at home with studio, one-bedroom apartments, a large dining area, a beautiful landscape courtyard, and even a salon. With professional staff and one-on-one care, your loved ones are our top priority. Welcome to the Beacon at Gulf Breeze. Welcome home.
Last year was a doozy of a hurricane season, and while we certainly hope for calmer waters this go-round, it helps to be prepared, especially for senior citizens who may be less able to make accommodations on short notice. Joining us today is Be Ready Alliance Coordinating for Emergencies, or BRACE, to help us be ready. Michelle, thank you so much for joining us today.
Thanks, Josh. I'm glad to be here.
For those who don't know, what is BRACE?
BRACE is a nonprofit disaster resiliency agency that works in Escambia County and around our region to provide plan, recovery, response, and resources for our community.
Okay. We don't need to relive last hurricane season. Certainly, I'm sure that's still fresh in everyone's mind, but tell us, in your mind, what did we as a community and maybe BRACE specifically learn from last year?
I think probably the biggest thing we could take away from the hurricane season last year is that you have to be ready. Pensacola was in the warning code for hurricanes 7 times last year.
Don't remind me.
Yeah, so what that means is that you have to know your evacuation zone. Do you know what you need to do at your house? Do you know what you need to pack if you have to evacuate? And do you know where you're going to go when it is time to evacuate? And what are the resources available to help seniors do that? So BRACE learned a lot. We partner with Escambia County Emergency Management to coordinate volunteers and donations, as well as to support activities with the National Guard. And so we're really excited about this relationship and the partnership that we have, and then our relationship with the Council on Aging to currently help Hurricane Sally survivors recover from the storm as well.
You mentioned seniors. Obviously, that's what we're here to talk about today. They are less able-bodied to respond at a moment's notice to an impending hurricane. What do you say to them? How do they prepare?
Well, I think the most important thing is to know your situation. If you know it's going to take you longer to pack, then take the time to get things pre-staged. When you're doing your disaster kit, if you're going to stay home, you need to have 7 days of medications on standby. Do you have someone that can come help you board up your house? What is your food situation? If you need electricity for medical assistance, what's your plan in case the power goes out? And thinking about all of those things ahead of time, then when something begins to happen, then you're literally just going to execute the plan you have. It's super important to write all of that down and have it in a location where when the warning code goes up and it looks like something's coming this way, you literally just grab that notebook out and start going down your checklist.
Yeah. I mean, we all know that feeling when you're in the cone, and it helps to have a plan already ready to go so you don't have to stress through that.
Right.
What do hurricane shelters look like right now, especially with COVID?
So the spacing in the shelters has changed. So it used to be you would only have 30 square feet of space. Now it's 60 because of the COVID restrictions. But although there is more space, you still are very, very limited in what you can take to a shelter. So, and if you've got a pet, pets are not allowed at most shelters. So you have to figure out what you're going to do and where you're supposed to go if you do need to evacuate.
Tell us about how BRACE helps the community both before and after a storm.
Sure. So before the storm, we offer disaster training, preparedness courses all over the area. If you are an active retiree, we have what's called the Community Emergency Response Team, which is CERT. That there's a series of trainings that are done so you can help your neighbors and help your community immediately after a storm. If you're part of an active community, we have something that's called Map Your Neighborhood, which is an evening course that basically talks about what are the disaster assets you have next door and across the street that help you plan for the next event and how to help respond to your neighbors in case of an emergency. So that's before the storm. And those trainings are offered all over the place. They can be coordinated at senior centers. We do work with the American Legion, with churches and other civil and social organizations out there. During a storm, we sit with emergency management and the operations center and are part of that response team. After the storm, we change gears. We are then responsible for volunteers coming into our community to help.
Sure.
Both those that are affiliated with local nonprofits and national partners such as the American Red Cross and the Salvation Army and Team Rubicon, as well as those volunteers that just show up out of the goodness of their heart and they just want to help. So we want to get them involved and we want to track the work they're doing and we want to document the hours because that helps the county and the state recuperate dollars from FEMA for the expenses that are put out. Also, after the storm, we do survivor assistance. So we have a disaster case management program that is done in partnership with Career Source Escarosa and United Way of West Florida to fund 7 case managers that work with survivors to bridge the gap between what their insurance may have given them, the little bit of money they may have gotten from FEMA, but the actual cost of the repairs that have to be done.
Sure.
And so we just recently had our first funding table and sent out $91,000 in assistance to repair roofs in the community.
Excellent. And excellent information. Hopefully we won't need the information,
Right.
But we certainly appreciate you providing it. Michelle, thank you so much for coming on today.
Oh, it's my pleasure.
Next, we're talking about a program that creates a multi-generational impact between kids and elder adults. Stay with us.
Since 1989, TLC Caregivers has been providing the special help people need to stay independent in their own homes. TLC is an employer of choice in the home care market. Our employees are screened with Level 2 background screens, drug-free, and have caregiving experience. If you have time, enjoy people, and are interested in joining us, go to tlccaregivers.com to learn more about becoming a TLC caregiver or visit us in Cordova Square.
There was a time in my life where I was extremely homesick. I decided that I needed a pet. When I first saw a turtle, my heart was full. He jumped up and kissed me and jumped right into my arms. I immediately went up to the volunteers at the shelter and said, I want him. He's got to come home with me. Not anything but lonely. Every day with Turtle is a perfect day and keeps me company when I'm doing schoolwork. I like it when he jumps up on the table too. He is a veggie thief. He's an incredible companion and my best friend. Can't say that I've met anybody that doesn't love him too. When I adopted Turtle, I discovered all the things that make him unique. He's a little bit of a lot of things, but mostly he's all pure love.
This is the story of a boy who didn't talk for a long time. The boy liked things to always be the same. Any changes would scare and upset him. The unknown was an unfriendly place. The boy was very sensitive to lights and sounds. So he built secret hiding places where they couldn't get in. The boy didn't like looking people in the eye. He wasn't trying to be mean, it just made him feel uncomfortable. Sometimes he would flap his arms again and again.
One day, I found out I have something called autism. My family got me help. Slowly, I found my voice and learned all the ways I could live with it better.
Early intervention can make a lifetime of difference. Learn the signs at autismspeaks.org.
When cancer tries to take you away from the things that matter most, Baptist Cancer Institute offers caring physicians and the most innovative treatment options. With convenient locations and a wide array of support programs and services, we're here to help you during the most difficult of times. As a member of the Mayo Clinic Care Network, we're bringing even more innovative cancer care to our community right here at home. When you need cancer care, we'll be there.
The foster grandparent program is different and even better than it sounds, with elder adults volunteering at schools and Head Starts to mentor at-risk youth. Unfortunately, this wonderful program faces some funding shortfalls, but a new fundraiser is on the way to help. Here to tell us more is Alicia Macklin, Program Director, and Jacqueline Penny, foster grandparent. Alicia, Jacqueline, thank you both so much for coming on today.
Happy to be here. Thank you so much, Josh, for inviting us.
Alicia, we've talked a lot about how the foster grandparent name is a bit of a misnomer.
Yes, it is.
Tell us what the program is.
Has absolutely nothing to do with the foster care system.
Right.
It is persons who are 55 and over, have an absolute love for reaching out, reaching back, and helping these students and these youth that are in our daycares, Head Starts, public schools, after-school programs, young mothers, at-risk teenagers, ones with developmental disabilities. They provide that nurturing and that care and that love, but they also provide that little kick of, you know what, you can get this done. And it helps the children see their potential, and it also helps our senior volunteers to realize health benefits as well, because they're giving back, they're getting out of the house, and they're being active and productive.
I love that. That's
Thank
a
you.
great synopsis. Jacqueline, tell us briefly, how did you get involved with this program?
Well, Alicia.
Okay. She's a great salesperson.
Yes. Well, my husband and I were going to a picnic every year with people he worked with at the base, and she just happened to be at this picnic. We got to talking about foster parenting, and we just got, and she asked me what did I do, and I said I was a teacher assistant for 16 years, and she said, oh, you'd be good for our program. Yes. And so I said, okay, so she gave me her card, and you told me to call her, and I did, and she told me all about the program, and I went, wow. This is down my alley, because I've been looking for part-time work and nothing was happening. And I said, here, I've been blessed to do this. So my husband was all for it too. And so I got with her and I started working. And I'm going into my 5th year starting in August.
Excellent, excellent
and
to hear.
I had truly love it. I've missed this year simply because of the COVID-19.
Sure.
But at the same time, I think about the children, and I think I know they need to be learning and stuff, and I can't wait to get back to teach them.
Tell us about that impact on the kids, because I think a lot of people assume, oh, well, they have parents at home, they have the teacher in the classroom. What more do they need? Tell us about that impact.
Okay, I'm gonna be honest with you. I have found that there's a lot of parents that don't help their children.
Sure.
And so we're helping them. Everything that children do with me is hands-on.
Yeah.
It's no paperwork. The only paperwork I do once in a while was math. But most of the time it was hands-on. And you can tell what children get help and what children don't. And so you really work with the ones that don't get the help.
Good.
And sometimes I work with them individually just to get them through the day.
Good.
And I've had a wonderful teacher that I work with.
Yeah.
I won't tell you her name. His name is Miss Pippin.
Okay.
She is wonderful.
Good.
And God's blessed me with that.
Awesome.
But I thought the other day, I says, I'm going into my 5th year. And it doesn't seem like it.
Because it's been so wonderful, right?
Yeah.
Tell us about the impact on you. I mean, that time has flown by, obviously. You must be having a blast. Tell us about what it means for you and what you imagine it means for other seniors.
Well, I have seen children grow in knowledge and everything, in all of the ways. And the thing that I really was impressed about is the way we work this program. That when you go in that room, especially when you have someone who supports you, you can do a better job of working with the children.
Sure.
And I have had actually most of the children hug me. And I had one child that would, every morning I walked in, she would hug me and then kiss me on my cheek. She had to do that. She says, I love you, Miss Penny.
Aw.
And that's the thing. You get a lot of love from these children. You give them love. You give them understanding. And they respond.
Of course they do.
Yeah.
I'm curious if there's a moment or a feeling in the past 5 years that has really stuck with you that maybe you think back on.
Well, I thought about when I was a teacher assistant. I go back to how I worked with children back then, and I worked with 6 groups at my last 2 years. I worked with first grade 6 groups of children.
It's a lot.
And yeah, every 30 minutes I'd get a group, and I would work with those children. And this is a little bit different, but you still get your groups. The teacher breaks them up in groups, reading and math, and that's how I work with them. And I'm gonna be honest with you, I have just always loved children.
Yeah.
My first job was babysitting.
Aw.
And I was 13 years old. And I babysat. And then as I got older, I wanted to be a secretary like my mother. But then as the years went by, I became a housewife. And then after, when my son was 16, my mother called me and told me that the teacher assistant position was open. Put in for it, they hired me. And I worked there for them for 16 years.
Well, I'm glad that we've been able to enable you to keep doing what you love doing. Alicia, we have just about a minute left, but I want to make sure I asked you, how is this program funded? It just doesn't magically materialize.
No.
And what does that look like?
Well, right now we receive funding from the federal government through AmeriCorps and hence down to the AmeriCorps Seniors Program. But of course, that funding is limited. And we were getting funding from the United Way of West Florida, but that was cut off. So we are looking forward to the Give 65 program, the fundraiser that you all will be doing through Council on Aging, because they really need those funds. They receive a very, very small stipend for doing what they do, and they give so much back. So if we can help them, then that's going to help the children.
I've heard so many foster grandparents say that they would do it even if they weren't paid.
Absolutely.
But it's still important that we pay them.
Amen.
Thank you both for coming on.
Thank
I appreciate
you. Thank you so much.
Until next time, enjoy life. You've earned it.